Welcome to Balance of Power. No, your TV is not on the fritz. I'm Marshall Zellinger in for Brandon Rittiman. And here's something else that's not on the fritz. We're still talking about Congress and health care. I wouldn't blame you if you thought the conversation was done for a while after 3 failed votes in the Senate and President Trump's tweet, "Let Obamacare implode, then deal." But the conversation's not over. It will continue, at least for the next 8 minutes. Later, you'll hear from Congresswoman Diana DeGette. Right now, we have Congressman Mike Coffman, who last week held yet another in-person town hall. Congratulations for that, Congressman. Let's go to the Senate's 3 failed votes right now. Were any of those bills viable to you?
Well, the last bill would have been viable just for a negotiating tool to get it to pass out of the House, get it to a conference committee between the House and the Senate, have negotiations occur over this month of August when Congress is not in session. That would have been the purpose of doing it, and I was disappointed that vote did not, that bill did not pass the House, just for purposes of having a tool, having a mechanism to negotiate.
If you got a skinny repeal from the Senate, are you yes or no?
Well, I would be a no vote if it was going to go to the president's desk. But if it was for purposes of going to conference committee for further discussions, knowing that that would never be the final outcome, I would be for that.
What about a straight repeal?
Well, I think that what my concern on a straight repeal, if you said, okay, we're going to repeal, and the date certain for the repeal was long enough out, where it wouldn't disrupt the markets, and it gave Congress adequate time, I think that would be appropriate.
Are you willing to say that you were part of legislation that helped save parts of Obamacare?
In the long run, we have to replace Obamacare. In the short run, I think that one of the fallacies is you could do it all in one swoop. I think the fact is, it's like turning an aircraft carrier around. It takes a little bit of time, and I'm content with that, not doing it in one massive bill, but doing it in parts and doing much of it as bipartisan as we can. I do think the fundamental concept is flawed, the structure in terms of saying everybody's policy has to be the same. We ought to force people to buy health insurance, a product that they may not want to buy, that there's so many loopholes in it that allows people to evade buying coverage and getting it only when they need it. The entire structure, in my view, does not work.
Have you talked with Senator Cory Gardner about health care at all in this process?
I have. So recently that the Senate bill failed, and that was unanticipated. My proposal for breaking the bill up and taking traditional Medicaid out of it. So I talked to him about that proposal. As with the Speaker of the House, and I sent it in writing to Majority Leader Mitch McConnell to say that I think the approach we've got is wrong. We need to take a different approach, and of course, the health insurance part I stated could be done in a bipartisan way.
What advice can you give Senator Gardner about holding an in-person town hall?
Well, he's got the whole state of Colorado, unlike me. I know he does periodic teletown halls where people from all over the state can call and he can answer questions. I've got a fairly compact district, so I do teletown halls and I do in-person town hall meetings as well as meeting with small groups.
All right, thank you, Congressman Coffman, for your time.
Oh, thank you for having me.
We continue our talk on health care, and a quick tease here, the NFL, with Democratic Congresswoman Diana DeGette. Congresswoman, now that it seems that a straight repeal is not going to happen, what are you willing to compromise on that will allow for some sort of bipartisanship here?
Well, everybody's known for a long time the Affordable Care Act has worked great for bringing insurance to millions of Americans that didn't have it before. I've said for ever since January, there's places where we need to improve it. We need to bring prescription drug pricing down. We need to improve for the very few people who are still buying insurance in those individual markets. We need to improve competition in those markets. The problem with Washington is, I say, here's my bill, and then the Republicans say, here's our bill, and then we have a big fight. Instead, we should do it in the way I did 21st Century Cures. And really, it's what any doctor would do if you went into his office. Identify the ailment and then figure out the treatment.
What specifically could be in legislation that says, we're going to cross this out of Obamacare, and Democrats, I'm okay with that?
Well, we need to improve things that are in Obamacare, not take things out. But here's some things we could improve, okay? we could reduce the cost of prescription drugs by letting the Department of HHS negotiate drug prices just like the Veterans Administration and your private insurance plan does. That would bring the cost of drugs down. We need to increase the competition in plans. What could we do to do that? We could have reinsurance in some of those plans where we need to do that.
Let me switch to the NFL here, and people are probably thinking, what, the NFL? You're talking to Congresswoman Diana DeGette. You're on the Senate committee, let me see if I have this right, on energy.
No, I'm on the House committee.
Sorry, House committee.
Don't give me a demotion.
The House Committee on Energy and Commerce and the Subcommittee on Oversight and Investigation,
right.
And that subcommittee kind of led the NFL concussion investigation.
That's right.
You recently sent a letter to NFL Commissioner Roger Goodell about $30 million that was supposed to be spent by the NFL,
Right.
and you're asking, you have $18 million more that you need
Right.
to spend on brain research. First of all, how can Congress tell the NFL anything?
Well, we have the power of the bully pulpit. And when we had that hearing, it was the first time that the NFL actually admitted in public what everybody privately knew for years. Football can cause concussion, which can cause long-term brain damage. And so during that hearing that we had, the NFL said they were going to spend $30 million in researching these brain injuries, but they only then actually spent 12. So we're wondering what happened with the other 18.
So how do you make sure that the NFL spends that 18?
I think when we ask them to, they will, because they committed to doing that.
So I need to shift to one story that our viewers probably don't know much about, and it's about a former staffer, an IT staffer that you had, among other House Democrats that also had this staffer that was recently arrested by the FBI on bank fraud charges. What have you been told about his arrest and the investigation?
So this is a former staffer who worked for several dozen members of Congress on a contract basis. And some months ago, our chiefs of staff were called together, and they were told that there was a criminal investigation involving this individual. We terminated his employment because, frankly, he didn't have access to the House information, so he couldn't do his job.
As an IT person, what kind of constituent information did this person have access to?
We don't have any information or belief that he has compromised any constituent information, and we have asked the investigators and also the House administration to please inform us if they get any information otherwise. If constituents have any concerns, though, they should feel free to contact my office.
Of all the lawmakers, you were one of the top payers to this person. How did you get connected
Well,
with
this was
person?
an independent contractor who helped a number of congressional offices with their IT systems. It's a common practice, especially with IT, and it was someone who had worked for a number of members of Congress and was highly recommended at that time. So.
Congresswoman Diana DeGette, thank you, and thanks earlier to Congressman Mike Coffman. I'm Marshall Zellinger, again filling in for Brandon Ritteman. Balance of Power is back next Sunday.